Hello, everyone. My name is Mackenzie Howell, and I will be talking about my current event presentation for week 4 on the topic of reducing medical errors within the healthcare system. Now, during my research, I came across the case of Radanda Vat. Now, this is a very unique case because it includes a criminal charge against a medical provider where they were charged guilty and they are serving a probation sentence as of 2022. Now, what went wrong during this case? Miss Radanda Vaught was tending to her patient, Mrs. Murphy, when Mrs. Murphy started to have a very severe anxiety attack prior to her upcoming surgery. Mrs. Vaught wanted to aid Mrs. Murphy in relieving her anxiety by giving her a dose of Versed in order to help her calm down. She did not, however, communicate this to the pharmacy, so the pharmacy did not ever prepare a Versed dosage for Mrs. Murphy. Mrs. Rodanda came up to the pharmacy medical dispenser and typed in the letters VE in her urgency to get back to Mrs. Murphy. VE popped up an option of Vercronium, which is a paralytic drug used to set patients into surgery so that they are unable to move. She picked out that dose and overrode the warning system from the medical dispenser machine, as well as not verifying the medication with her charge nurse before giving the dose to Mrs. Murphy. She did give the Versed dosage to Mrs. Murphy in Vercronium. However, that much in Vercronium is very lethal. Thus, whenever Mrs. Vaught left the room, Mrs. Murphy began to have a very violent reaction to the paralytic, and she ended up passing away because of it. Now, unfortunately, within a healthcare system, there are many ways that medical errors do pop up, and medical systems do not like to address these because they are so prevalent. The first category of why medical errors happen is due to provider burnout. A provider who is not supported within their workplace becomes unmotivated and unwilling to provide the best quality of care they can to their patients because they don't feel that they are understood within their workplace. Leading up to the second reason why there are medical errors is because of exhaustion from working conditions. Because there is the lack of support within administrators and the clinical side of the system, there seems to be a disconnect when making sure that the proper support and aid is provided to our nurses and providers within the workplace. And without this aid and support, they feel as though that they are not being cared for and that they are just a tool to make sure that the system runs successfully. And because of this, there are very high expectations for the quality of care that should be given out from these providers. But this is impossible whenever there are large clinical staff shortages all over the United States. We have seen how staff shortages affects the mental health of our providers during the COVID-19 pandemic when the demand was so high for nurses and providers to perform the best they could while also working double to triple shifts at a time to support the many COVID-19 positive patients that were coming in. Now, in addressing reducing the amount of medical errors that do occur within a healthcare system, is charging a provider in a criminal case the appropriate way to address this issue? Because if we charge them criminally, it does induce and instill a fear of the expectation of what quality of care we as administrators are expecting from our nurses. And if they can't give that sort of care, then they should be punished because of it. Or is there a different way to address this, such as a better implementation of practices within the system itself? For your discussion board, you should think of a way or an implementation approach that you think would best reduce medical errors, and also give your opinion on if charging providers criminally will be the right incentive to stop medical errors.